So Richard Clayton, my friend for decades at this point in this work. So thank you for being at the conference again, and just tell us a little about all the work you've done. You've done great work in this father move the last 20, almost 30 years.
Oh
So
my
tell us about your
goodness.
work.
I started out doing projects for young fathers, and that was, with Dr. Johnson and others, working with young fathers really around the child support issue and trying to get them in a space where they would be financially and emotionally responsible for their children. And what we found in doing that work was there really was a number of opportunities to engage fathers, most notably fathers who had not had positive interactions with their own father, fathers who hadn't had a lot of positive role models in their life to teach them how to be good men and responsible fathers. So I, that just inspired me, and I, frankly, Ken, I haven't stopped, since back in the day. I'm working on a project now, the Nurturing Fathers program, where we are responsible for providing technical assistance and support to the local child welfare system. And so we have programs that we do. We've trained about 1,200 people in the last 4 years to do the Nurturing Fathers program, and we've seen some incredible success. I think most notably because the model comes with an evaluation tool that really looks at folks' changes in their parenting attitudes and changing in their parenting behaviors. So it's really been a pleasure for me to work on a project that has some evidence attached to it, as opposed to feel good stuff where you're just out there looking at the guys saying, "I hope you're doing a good job and I hope you're getting better at it." It really has been a boost for me in the last couple of years to be working on this one. Yeah.
And I know people hear that term, nurturing fathers, because they have a nurturing fathers network program and whatnot. But can you talk a little bit more about what you guys do? Really, it really speaks to the nurturing of fathers and what's needed and what you all are providing, because it's a little different from what people may think just from the name.
Correct. One of the approaches that we go with is that it's really sort of important, and I think we have a larger impact in that we start around helping fathers develop healthy relationships with their children. That it's not. You can't get caught up in concentrating on the relationships with the mom and the relationships with the system and all of these sort of inconsequential, I call them at some level, relationships when you're trying to be a good father. That we really try to get them focused on their parenting, focused on their responsibilities as dads, and focused on their children, and really looking at what does it take for you as a father to participate in the healthy development of your child. And I think it changes the context of the conversation for us, because it's a positive message. When you start connecting the dads to their children, you can sort of get past all of the other things. We're running right now a 13-week structured session. Again, it's evidence-based. We see the results of it, and then we have, additionally, most of the graduates come back for father support groups, because the message is so clear and it's so good that when the 13 weeks are up, the dads say, "Okay, so what do we do now?" So we really are looking at child development issues, ages and stages of development. We start a new one around trauma-informed practices and how to really help the guys get through their trauma and depression, and help them sort of understand how that impacts their children and their relationships with their children.
So as you're focusing, as you're helping men focus on child development, once they lock into that, can you describe what happens with these dads as far as their development and evolution as they've now connected? What have you seen?
One of the bonus to that is that we have a group of probably 6 or 7 guys now that work with us. We call them the Fatherhood Ambassadors. And so these are graduates of our program. They're trained facilitators. But in most cases, they've come through various stages of relationships with their children, with the child welfare system, with the court systems, and to watch and listen to them tell a story about how they've changed their lives, most notably, but how the changing of their life is impacting their relationship with their children. Like I said, it really sort of looks very differently when you can get a guy to sort of be self-centered in the idea that he has other responsibilities besides always thinking about, sort of the individual, that you can change that focus and look at that village. And I said, there's a number of things. We got a plan now in this one. I'm waiting to see, because it's the first time we're going to try that. We've got 4 groups that are going simultaneously up in Boston, and we have one of the sessions is a play shop where the guys bring their kids, and so we know there's a diversity in the ages, and so we're setting up an ages and stages developmental sort of process for the guys. So the guys with the young kids will really be looking at fine and gross motor skills development, brain development, and really getting information about what that is and what that feels like, all the way up to dealing with the teenagers, with the social media, and how to get your kids like off of that.
So I think what's great, Richard, because when you and I met, we were fatherhood. When this nation looked at fathers, it was like deadbeat dads time. And so I've watched you, especially because you came through the Department of Revenue, so collection and all that. So as you've watched this movement evolve and the way we're looking at fathers, what do you think has been most exciting as we've seen this kind of different perspective of dads today versus back then when we started this work?
I can tell you, I am humbled at every opportunity that I have to be in a different sort of social atmosphere, right? So like you said, we started out thinking of this as a infant mortality, issue, and how to get the dads connected to the moms and their children and really start thinking about a healthy lifestyle. But again, I've watched it transform to child welfare. We're doing some projects with the sheriff's department in Boston, where we're literally doing fatherhood programs in the jails and as part of a reentry program, bringing them into our community-based fatherhood programs too. So it's sort of the bonus for me, and again, it really is a humbling experience, is to know that I've been around long enough to see the interest around working with fathers transform to systems where, when we first started, even at child support, the people looking at me like I was crazy. You're going to do what? You're going to help what? Like Healthy Start, we're going to the mom saying, bring the dad in and we can work with him. But to see sort of the transformation and sort of, the advantage of being around long enough is, and I was just sharing this with somebody else, is that I have had an opportunity to do some things that didn't work. And so there's always sort of the blessing in knowing that I can give some guidance, I can give some, some knowledge, I can share some experiences with folks that are just starting in this field, where we really have sort of now begin to, evaluate programs and really look at what are effective models, and let them know, don't be discouraged when you buy 10 pizzas and 4 people show up. You know what I mean? Don't find yourself in a place where you're letting somebody else sort of set the agenda for you and not the fathers that you're working with, because you really have to be clear about who it is you serve. I mean, I'm humbled with you because you and I both saw this as an opportunity for us to serve. And I think that's there's a blessing that comes with that, and my blessing is to tell you, 20 years later, a blessing of longevity, good, bad, or ugly, is the idea that I haven't given up on this yet, and I have no plans to, frankly, no plans to.
Well, just like Jeff Johnson, we can sing that song. I've had some good days, some hard days, hills to climb, but here we are.
That's absolutely.
So, but I want to personally thank you, because I know about your work over these decades, but I appreciate what you've done in your work, but also the foundation that you continue to provide for many that are moving forward in the work. So thanks for your time today.
Thank you, little brother.
That's right, little brother.